If you have upper arm pain and you'd like to learn what's causing it and how to relieve it, then this video is for you. I'm Dr. Dave Candy, and in this video, I'll explain two of the most common causes of upper arm pain, plus some tips that you can use to start to relieve it right away. Plus, I'll share some additional tips to help keep the pain from coming back in the future. Now, two of the most common causes of upper arm pain are either a problem in your neck, particularly the C5 nerve root, or a rotator cuff problem, either a tendonitis or a rotator cuff tear. Now, additionally, a fractured arm or fractured humerus can also cause upper arm pain, but that typically happens if you've fallen and landed on an outstretched arm, or you've had direct trauma to your arm. If you've had either of those, make sure to get an x-ray and just make sure you don't have a broken arm, because there's not a lot I can do to help heal that. That'll just take some time to heal up. So we're going to deal with the other two causes in this video, the C5 nerve problem in the neck and the rotator cuff problems. So first, let's start out with which one's causing it. Is it your neck, or is it your shoulder or rotator cuff? Now, interestingly, a lot of times when I see patients in the clinic who come in with a diagnosis of shoulder pain or rotator cuff tendinopathy, they'll say, my shoulder doesn't hurt. It's my upper arm that hurts. It's right there. And a lot of times, upper arm pain is the more common symptom of a rotator cuff tendinopathy. But it doesn't necessarily have to be an either or, and in many cases, there are contributions of both the neck and the shoulder combined. But usually one is more problematic than the other. To distinguish between the two, we're going to do a couple of movement tests. The first one is just going to be testing range of motion of the neck. So try turning your neck as far as you can one way and noticing just how much pain you have, as well as how far you can look. And then go the other direction as far as you can go. And notice if either of those change your upper arm pain at all. That can be either makes it better or makes it worse. But if turning your neck one direction or the other changes the pain that you have in your upper arm, it's very likely that your neck is involved. Additionally, try looking up or looking down. If you have degenerative disc disease in your neck or spinal stenosis in your neck, where you have some narrowing around the nerve roots, oftentimes looking up may cause some referred pain down into the arm. Additionally, you want to try to tip side to side. Again, going away from the sore side opens up the spaces where those nerve roots come out, but it also puts the nerves on stretch. So depending on the type of nerve problem you have, this could either provoke the pain or relieve the pain, but in either case, you'll know it's involved. And then go the other way. When you go this way, it narrows the spaces where the nerve roots come out of your neck. And if that makes the pain worse, then that could potentially be a cause of the pain. Next, we're going to do a couple movement tests with the arm. Typically, if you have a rotator cuff problem, some of the most commonly painful movements are reaching above your head, like that, reaching across your body, like that, or reaching behind your back, like that. If any of those three movements cause your pain, then it's likely that you may have a rotator cuff problem, at least to some extent. Now, is it torn or a tendinopathy? You can't really tell from those specific tests, but you can at least tell that if moving your shoulder seems to provoke your upper arm pain, then there's a chance that your shoulder or rotator cuff tendons could be involved. Now, what you probably really want to know is, how do I get rid of that pain in my upper arm? Well, again, that depends on what's causing it. But the movement test will often tell you what you need to do. If going this way makes your arm pain worse and going this way makes the arm pain better, then do the direction that makes the symptoms better. Pretty common sense, right? Now, another thing that you may not think about is that when your arm hangs down, that can also pull some tension on the nerve roots. It can create compression between the vertebrae of your spine, because your shoulder blade basically hangs from your neck by muscles. And so when your shoulder blade is being pulled down, it can pinch the nerves in your neck. So you might also try just supporting the sore arm with the other arm and seeing if that changes it. If it does change it, getting good arm support by resting your arm on pillows or resting it on the armrest of a chair or of the couch can be another good tip that you can use to take some pressure off the nerve roots in your neck so that the outside of your arm doesn't hurt quite so much. Now, what about for your rotator cuff muscles? What do you do if the shoulder pain or upper arm pain is coming from your rotator cuff muscles? Well, one of the quickest treatments is to do some trigger point work to the muscles. There are 3 of your rotator cuff muscles, 3 out of the 4 of them, that commonly will refer pain to the upper arm. The 2 most common ones are the supraspinatus and infraspinatus. The supraspinatus sits right above what's called the spine of the scapula. So supra means above, and spinatus means the muscle that's above the spine. So supraspinatus is above the spine. And then if you go just below the spine, underneath that little ridge right there, that's the infraspinatus. Now the supraspinatus is the most commonly torn rotator cuff muscle, but it's usually the tendon that's out closer to the shoulder joint. The muscle belly is back more medially over top of the spine of the scapula. And the best way to release a trigger point in the supraspinatus is just kind of digging down into it using your fingers. You can also use a trigger point cane, which looks kind of like a shepherd's hook that you put over your shoulder and apply pressure down on that supraspinatus muscle as well. Now, one of the easiest ways to release a trigger point in the infraspinatus is by using a tennis ball. And what you'll do for that, you'll lie on your back and position the tennis ball just behind your shoulder blade. So it takes some rolling around to get it in the right spot. But once you find the spot that's kind of sore to press on, and ideally if this is the cause of your upper arm pain, it might even provoke the upper arm pain just a little bit. So find that sore spot under your shoulder blade and then lay there for about 1.5 minutes. It does take a little while for trigger points to release, so you have to be a bit patient. And over time, you should feel tension in that trigger point release, and it should become gradually less sore with time as you lay there. Now, the third muscle that can cause upper arm pain is the teres minor. That's a little muscle right underneath your arm here, kind of almost in the armpit, and then it connects to your upper arm bone or your humerus. You can also release that one with a tennis ball by lying on your side and kind of putting the tennis ball just on the side of your scapula or shoulder blade. So you'll kind of find the outside part of the shoulder blade. Again, this should be a little bit tender or a little bit sore if you get it in the right spot. And then once you find that tender or sore spot, just lay there for about 1.5 to 2 minutes. Now, I should note that it is helpful to do this on a hard surface like the floor. A soft bed probably won't work, but if you can't get down on the floor, you can take something like a baking sheet and put it behind you as a backing so that it gives it a little bit more of a firm surface, and that way the ball doesn't sink into the bed and you get good pressure up against those trigger points. Now, additionally, while you're lying down, doing a stretch known as the sleeper stretch can help if you have stiffness in your teres minor and or infraspinatus. That's a stretch where you take the shoulder and go down like this. So you're pretending there's an axis through your upper arm. You want a 90-degree angle to your body and roughly a 90-degree angle at your elbow. Then you rotate down like this, and this stretches out the muscles in the back of the shoulder and the posterior capsule. So the infraspinatus and the teres minor both get stretched when you do this. Now, the bad part is that can create some impingement or pinching of the rotator cuff tendons in the front. So there's a modified version of the sleeper stretch that I really like, and here's how you do it. You'll take your opposite arm and put it on the front of the shoulder like this. You're going to put a little bit of a pressure down through the shoulder. You're not right on your collarbone, and you're not down the arm either. You're kind of right at the crease of the shoulder joint, and then create a pressure downwards like that. That helps keep the ball of the shoulder from gliding forwards in the socket and pinching rotator cuff tendons. Next, you'll rotate your arm down this way and just put a little gentle pressure on it with your elbow. You might not even really be pushing down with the elbow. It's more just finding the end range motion and then using the elbow just to hold it in place, maybe a very slight overpressure. And then ideally, you want to hold this stretch for a long period of time. It should be a gentle, long duration stretch. And what I mean by that is 5, 10, 20 minutes, they say in research, but realistically, 5 or 10 minutes is probably about the most that most people can tolerate. So find a comfortable, gentle stretch, and then find something to do, watch TV, listen to some music, do something to kill some time for 5 or 10 minutes. Now, speaking of the sleeper stretch, your sleeping position can also play a role in upper arm pain. Many people notice that they have upper arm pain when they first wake up in the morning. And you need to have your neck adequately supported, as well as make sure your shoulder's not in a position where you're irritating the rotator cuff tendons at night. And to learn more about proper sleeping positions for shoulder pain, check out this video over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.